So thank you for having me today. I just want to start by just acknowledging the moment that we're all living in and just really hope you and your families are all healthy and well at this time. My name is Ashley Edwards, and I'm the founder and CEO of MindRight Health. We are advancing health equity by making mental health support radically accessible and inclusive of communities of color and low-income families. And we are particularly focused on youth. So we do this work because, as we all likely know, we're currently living in a mental health crisis. Even before COVID-19, suicide rates and drug overdoses were higher than ever, actually causing the largest drop in American life expectancy in the past 100 years. We know that this impacts us all, but this disproportionately impacts underserved communities, as was mentioned by our panelist earlier. As we all know, COVID-19 has only exacerbated the health disparities, trauma, and social isolation experienced by low-income communities and communities of color. Unfortunately, these groups also tend to be the least likely to engage in plans and utilize traditional behavioral health services. So given all of this, at MindRight, we asked ourselves, how can we provide destigmatized and accessible mental health support that meets the needs of multicultural Medicaid populations? And that's why we developed MindRight. We know that younger generations live on their phones, so we want to meet people where they are. We provide trauma-informed and culturally responsive mental health coaching all over text message. There is no app to download. Our service is purely over SMS text message to make it as accessible as possible to young people. Our service is also non-clinical intentionally and provides unparalleled access to support by offering our coaching service 7 days a week, 365 days a year. This allows us to reach young people, not just in moments of crisis, but also on their good days, which allows us to develop strengths-based interventions for communities of color. Through our service, we're creating a continuum of support that typically does not exist for youth. For communities that do not traditionally engage in formal therapeutic services due to high stigma or lack of access, we serve as an ongoing source of culturally responsive, preventative, and non-clinical support. So here's how MindRight works. To sign up, all a member has to do is text us. Like I said, there's no app to download. Once they sign up, they pick a time that they'd like to talk with their coaches every day, and then we match them to their personal team of trained mental health coaches. Every day, their coaches are proactively checking in with them, providing strategies to overcome challenges and tips on how to develop positive coping skills. Since we're a daily service, we build trust with members, and we end up becoming often the first people who members share their needs with. We then use real-time member needs to partner with member care teams to enhance care coordination and better connect members to resources to improve service utilization and reduce long-term costs. So you're probably asking yourself, who are our coaches? Our coaches are mostly social workers in trainings. We partner with schools of social work and have MSW graduate students who coach with MindRight to complete their field placement hours. We also recruit community members who have shared lived experiences as our members. And all of our coaches, whether they're MSWs or community coaches, they all go through our intensive training process, which includes background checks, role plays, exercises, etc. And it's important to highlight that all of our coaches are supervised by licensed clinicians who are providing real-time guidance and support during these coaching conversations. Our clinicians are monitoring coaching conversations via our tech platform, snapshot shown here. The licensed clinicians also are the ones stepping in if there's ever any escalated situations with members that require higher levels of support and triage. So far, we've been really pleased with our early pilot engagement results. We're currently receiving over 12,000 text messages a month from members, predominantly African American and Latinx populations who are seeking daily emotional support. In 2020, our members have actually stayed engaged with our service for over 4 months on average. And again, we're texting young people 7 days a week, so feeling really great about that retention rate. our most engaged pilot member has actually been texting us for over 2 years. And so again, we're really with people every single day, building trust with communities that have been traditionally hard to reach, to the point where they really feel a connection with MindRight. They trust us, they relate to us, and we're able to leverage that to improve their care. And then in addition, we see on average 9% of all members that we serve end up disclosing to MindRight that they're experiencing a crisis. And our team is able to step in and stabilize them and link them to planned care teams for support. So as an example of that, we've had members who have disclosed abuse to us that they've never shared with anyone before. We've had members, for example, who was seeking trans-friendly therapy options and had no idea how to navigate their plan, all of which our internal care coordination team is able to triage and coordinate with the plan and connect those members to care. So through our partnerships, we're also able to identify unique wellness trends in different subgroups of Medicaid populations due to the nature of our daily real-time text data. So this chart is an example of the trending conversation topics and emotions from a Medicaid population that we served. So through our data, partners can really slice and dice our conversation insights by race, ethnicity, gender, age, location, etc., and observe how that data changes in real time. You don't have to wait for a monthly report, a quarterly report, an annual report. You can literally watch these stats change day to day for different groups. So in this example shown here, we were able to share this information with a Medicaid partner and call out, for example, the trending feelings of hopelessness and depression among Latinx youth members. And if we wanted to go deeper, we can know specifically Latinx males who were 16 years old, how they're feeling, etc. Our partners then have the opportunity to better allocate resources and services to address real-time member needs. So aside from our initial insights, the direct feedback from MindRight members has been powerful. The majority of our members echo these statements shown here, really feeling alone and isolated before using MindRight. So at MindRight, we were providing this virtual support and filling this critical service gap even before the onset of COVID-19. And we're really excited to remain a readily accessible mental health support that all members can continue to rely on before, during, and after the pandemic. And we also feel we have the right team to be doing this job to support your members. On our team, we have combined expertise in clinical social work, innovating in community health. We've been recognized by Forbes 30 Under 30, among others, for our work. We're also advised by Dr. Andrea Ostrovsky, the former CMO of US Medicaid, and we're proud to be backed by a strong group of investors. So as an early stage startup, right now we're seeking Medicaid pilot partners. The ideal partners for us are those who are passionate about increasing access to care and addressing social isolation for underserved communities, and particularly communities of color. Those who are excited to contribute to further impact evaluation of our service. And then also those who are aligned with our commitment to increase culturally responsive services for diverse communities. And in closing, I always like to end on this quote from one of our members. This was actually said to us way before COVID-19. He says, "I used to fear that I would be lonely, but now with MindRight, I have this backup and I no longer have to fear being alone." At the end of this day, we do this work to make more people feel less alone, and we know that's important now more than ever. So if you're interested in learning more about how you can partner with MindRight, I've included my contact information here, and I am happy to answer any questions.
Thanks so much, Ashley. MindRight feels more important than ever, and it's really great to see a platform like yours reimagine mental health services to advance health equity for low-income youth of color. So the first question that I have for you, have you seen changes in the types of conversations as a result of COVID and after the death of George Floyd? And does anything in your model or care delivery change?
Yeah, we've absolutely seen changes. So before COVID-19, MindRight for a lot of young people was kind of a secondary support to in-person supports they had in their lives, whether it was a basketball coach or favorite teacher or a counselor who really supported these young people. And now since COVID-19, where these traditional supports have been cut off, MindRight has really transitioned to being a primary support for a lot of young people. And even when it comes to insights that we've had just in daily conversations, race and identity continually comes up, a lot of feelings of pain and hurt, trying to understand why these things are still happening, a lot of concerns around immigration for our undocumented students. And then we've also, last month, we had a peak in self-harm that was disclosed at MindRight while young people are at home. And oftentimes now, unfortunately, quarantine in environments that aren't always emotionally safe for a lot of young people right now. So that's a bit of what we've seen. And fortunately, MindRight, the way we were structured, it was exactly to fill this need. So if anything, during COVID-19, we're just trying to reach more people.
Thanks. And another question that we received is, can you speak to the non-clinical versus a clinical approach, and what are the pros and cons of either?
Yeah, I think there's a need for both. There's a lot of companies and interventions right now that are clinical in nature, and those are absolutely needed. At MindRight, we understand that within communities of color and low-income groups, there is a history of stigma, lack of access, and a lot of times historical harm that has been done to those communities by service providers. And so we find that those communities instead naturally are leaning on informal methods of support, like I mentioned, whether it's the pastor or the coach, et cetera. And so we find at MindRight, we're going after those people who are not yet ready to enter into clinical intervention, and we validate that. And we are that intermediary bridge, and we can help get people therapy ready, but we also want to acknowledge that not everyone's there yet, and services still need to be provided for that population.
Great. And so you mentioned stigma a few times. I would be curious to hear like how you build trust and stay relevant with this youth population.
Yeah, what we've seen and what we're really explicit in how we design MindRight for equity, in a lot of clinical settings, there's an inherent power dynamic between the provider and the patient. And at MindRight, we really try to flip that on its head. And that's a reason why we are texting people every single day. We don't ask you to tell us your deepest challenges the first day we're texting. It could be the second week, the second month, it could be after 3 months. As an example, we had one young man who was texting us for the first month or so. He was mainly just talking about basketball and sports and his relationships. Fast forward 3 months later, he's talking about depression and isolation that he feels once his dad was released from prison and never visited him. So it's really about trust, and I can't underline enough how important building trust is in these communities, and why we feel really proud of the service that we've built to reflect the diversity and the needs specifically of communities of color.
Thanks, Ashley. It's really exciting to see just how well you know this patient population. So thank you.